Hi, I'm Kelly. I'm a cancer support worker from Yeovil Hospital, and I'm just going to talk through some simple exercises that may help if you're experiencing some anxiety. Anxiety can happen at any point. Some people find the time after they've completed treatment, when they're waiting for scans or blood tests for the first time, can be quite an anxious time, and sometimes waiting for those scan results can be particularly anxious. Sometimes that anxiety can creep up when you really least expect it to. This is really common, and you are not alone. It affects a lot of people. When we're feeling anxious, this affects our breath. So as anxiety builds, our breath gets quicker and quicker and quicker. So one thing that you can do that can help combat this is simple mindfulness techniques. Now, it's not for everybody, and some people find it quite difficult, but it is something you need to practice. So I'm going to go through a really simple mindfulness technique with you now. So please close your eyes if you feel comfortable to do so. If you're not comfortable in doing so, just focus on a spot in the room. Sit with your feet planted on the floor and your back resting on a chair with your hands in your lap. Focus on taking slow breaths in and out, making your breath out slightly longer than the breath in. Notice his breath coming in, how it feels coming in through your mouth or nose, and how it feels coming out. Notice the sensation of your lungs emptying, your rib cage falling as you breathe out. Notice the rising and falling of your abdomen. Notice what thoughts are passing through your mind. Notice what feelings are passing through your body. Observe those thoughts and feelings without judging them as good or bad. Don't try to change them, avoid them, or hold on to them. Simply observe them. Notice what it's like to observe those thoughts and feelings with an attitude of acceptance. When you are ready, slowly open your eyes or bring your focus back into the room. This exercise may be good when you have time and space to practice it. If you're out and about and you begin to feel anxious, this isn't quite so easy to do. So one handy exercise that I myself have found really helpful is the 5 things technique. This is where you find 5 things you can see, 4 things that you can feel. That might be the feel of the clothes on your skin or the air on your face. 3 things you can hear, 2 things you can smell, and 1 thing that you can taste. If you're feeling really anxious and that anxiety is impinging on your everyday life, it's really important that you speak to somebody. And this could either be your GP, your clinical team, or the cancer support workers. And we'd be happy to point you to other resources or other support services that may be able to help.